Heart transplants are usually done when your heart isn't functioning properly. Transplants are usually taking place to patients who have heart failure, heart disease, or cardiomyopathies.
Doctor, I have been bleeding out of my earlobes for the past couple days. I have a stomachache and my leg got ruptured. I was hoping you could help me out.
I think what you need is a heart transplant.
Patients must first agree to the actual procedures and requirements for the surgery. These can include quitting smoking, quitting drinking, getting a better diet, and dealing with any emotional stress that may come along with the surgery. They would also need to understand the statistics of having the surgery, that being an 87% chance of living the first year after surgery, and also a 50% chance of living the first 10 years after surgery.
Do you smoke?
No.
Do you drink?
No.
How much McDonald's do you eat a day?
No.
You have an 87% chance of living the first year and a 50% chance of living the first 10 years. Are you okay with that?
No.
A heart transplant is when a patient's heart is replaced with a donor's heart. The patient's heart is removed by transecting the aorta, the main pulmonary artery, and the superior and inferior vena cava. The donor's heart is then connected by sewing together the recipients and the donor vena cava, aorta, pulmonary artery, and left atrium.
We're going to place your bad heart with your good heart.
I don't recall agreeing to this surgery.
Beep, 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 beep.
You would be required to stay at a hospital for 1 to 2 weeks. Sometimes if there are complications, you are required to stay another 3 months in the hospital. While staying there, you will be required to take rehabilitation programs and must follow better habits for you. You will also need blood tests and a heart biopsy to check up how the new heart is doing.
Hey, how you feeling? Oh, here, have a chocolate.
While heart transplants are relatively safe, there are some risks that you need to take involved. Sometimes after surgery, complications can occur. Some of these complications are rejection of the donor heart, infections, clogging of the arteries, and death.